Hi, I'm Dr. Mangesh Kamath. I'm a medical oncologist. I have seen a lot of sarcomas in my career and bone tumors in my career. So I thought I'll make this short video for you so that you can understand how medical oncologists like me treat sarcomas and bone tumors. Now, what is sarcoma? Sarcoma is basically the malignancy of the soft tissues of our body. The malignancy of the skin or the inner lining of your mouth and the stomach is called as carcinoma, and sarcoma includes the bones, the muscles and other supporting tissues in our body. It is not as common to get bone tumors and sarcomas as it is common to get other cancers like lung cancer, breast cancer and so on. It's relatively rare. However, sarcomas are very complex to treat because there are many varieties of sarcomas. More than 80 varieties of sarcomas are there. There are sarcomas of the bone, sarcomas of the muscles, sarcomas of the fat tissues, sarcomas of the lining of the nerves. Each of them are named differently. Many of you would have seen some friends of yours would be having small bumps of fat on their hands and legs and on the body as well. And these small lumps are actually mobile. They don't cause any pain, but you can see it. These are called as lipomas. Lipomas are nothing but an abnormal collection of fat under the skin of the individual. Most of the time, lipomas don't cause any problem. But in a small percentage of patients, lipomas can turn into liposarcoma. And these can then spread to other parts of the body. And they can be extremely devastating if not treated properly. So, whenever you have a bump in your skin or a lump in your skin, we usually recommend for a small ultrasound scan. And if it looks shady, then we proceed to do a biopsy. And if the biopsy proves that it's a sarcoma, then we go ahead and do the other test to stage the sarcoma and then do the surgery and or other treatments apart from surgery. Bone tumors usually occur in the younger adults, children, and early middle age. And there are multiple varieties of bone tumor as well. There can be osteosarcoma, there could be chondrosarcoma, there can be just simple giant cell tumor which is not going to spread too much, and some other diseases. And each of them have to be diagnosed clearly before we go ahead and treat them. If we diagnose them well, if we discuss about treating them in a very standard manner, they can be one of the most curable types of cancers that we know in our practice. But we have to make sure that they are very well evaluated before starting on the treatment. I have seen in my career so many bone tumors and sarcomas which have not been treated optimally, and unfortunately many a times it's difficult to salvage the situation. So if you have a sarcoma or if you have a tumor which has been diagnosed newly, do not hesitate to get all the information from only an oncologist, because that would really go a long way in ensuring that you're cured of the cancer. So folks, cancer of the soft tissues, otherwise called as sarcoma, are common, and make sure if you have any lumps in your skin or around the bone, make sure you consult an oncologist and get the right treatment for it. Thank you.